Hey there, welcome. It is the Nisha Jackson Show. My name is Rusty Humphries. She is Nisha Jackson. We sure appreciate you being here. Make sure you go to nishajackson.com or onepeakmedical.com. And also, would you please hit the subscribe button and share this video? This one's an important one. You've been hanging out with a big-time guy, and I always... Yeah, do you ever have any of those words that you always say wrong or you're never sure? Do you have any of those?
Yes, like his name?
Yeah, I don't know if I call him Dr. Daniel. Amen, amen, amen. I always get confused. What is it properly?
It's Amen.
Amen. Okay, Dr. Amen. He's a very famous brain guy, right? I've talked to him a couple of times, but describe who this guy is and why you're so excited about him.
Yes, he is my new guru. He is probably the world's most famous psychiatrist. We'll call him that. He is a brain specialist. He's very, very, very into scanning the brain. And so he's been doing this particular type of brain scan. It's not an MRI. It's not a CAT scan. It's not an X-ray. It is a SPECT scan. And a SPECT scan is a way of looking at the brain that allows you to see how the different parts of the brain are actually working. So are they getting enough blood flow? Do they have enough nutrients? Are they functioning and firing up when they should be functioning and firing up? Are they not active at all? Are the things that you're doing in your lifestyle, drinking alcohol, taking drugs, worrying excessively, not sleeping, post-traumatic stress disorder, bipolar, whatever it might be that you're struggling with, this scan actually shows how it's affecting your brain. And then what he does with the help of many other healthcare professionals that he has trained is they read the scans and they work with you on understanding what your scan shows. And then they put you on a treatment program to basically rehabilitate your brain.
Wow.
So, and that means that they can show a follow-up scan, and there are lots of pictures I'm going to show you today that show how the brain recovered itself. It is one of the only organs we have that actually can recover itself. Like it can recover.
So you really feel confident in what Dr. Amen, right?
Yes.
You're confident in what his beliefs are and what he does. I mean, he's controversial. Some people don't really buy into it, but you've met with him, you've been trained, you understand it, and so you think he's on the right path.
Well, I think it's controversial because he's scanning the brain and he's making a diagnosis of this. What you're doing is not working for you, and this is why. Or you're having anxiety because this part of your brain is underactive, and we're going to put you on a treatment program to bring it back. He has tens of thousands of scans before and after treatment programs that are phenomenal. Now, if you're the type of critic that doesn't believe that lifestyle, stress, nutrients, chemicals don't affect your brain at all, then this guy's not for you. You're going to think he's a quack, but he is far from that. He is very well known. He has been on every show. He's done many hundreds of research studies that have been peer-reviewed research studies, and his work is phenomenal. Now, of course, I buy into it because. And you don't really have to buy into it because you can just experience it and see it for yourself. But this is what we do in our practices is we optimize people. We optimize their whole health and it changes things. They have less inflammation. Their brain starts working. It's like it wakes up. It's like, thank you for giving me what I needed. So I would say anyone suffering from ADD, poor concentration, memory, like early problems with memory loss, severe anxiety, chronic insomnia, anything that's negatively affecting the brain, depression, habituation, problems with you can't get off drugs, alcohol, smoking, whatever. This might be a track you want to take because his success rate is very high.
Now you've mentioned a couple of things that really seem to be in epidemic proportions, it seems like. Depression,
Oh,
ADHD.
yeah.
What kind of things do you do? So you go get scanned, and then what would happen if your brain showed that you were depressed or ADHD? Does that show up in the brain scan?
Yes, it does. Well, it shows up in different ways that it might be affecting that center of the brain, that part of the brain. I've had a lifelong interest in the brain. I'm so interested in human behavior. I'm so interested in the emotional parts of the brain. I'm really interested in how people can fire between one side of the brain and the other. The brain is so interesting to me. And is there one thing that people are afraid of more than losing their brain? I don't think so.
No.
Because if you don't have a brain, I don't even know, you can't do anything, right?
Right. I mean, you deal with somebody that's got Alzheimer's. I mean, it's so depressing. It's scary. I mean, it's like you feel like, anyway, it's like you're locked. They're locked inside themselves, and
Yes.
and I'm sure they're just. Or my grandmother who had a stroke and she couldn't communicate. Oh my goodness! It's
Yes.
you're
Yeah, it's one thing that you really have to pay attention to, and you really have to nurture and take care of. And the great thing about the brain, even if you've really messed up your brain and your scan looks awful, like I'm going to show you a picture here. This is the brain.
looks like an alien.
Yeah, so you basically, here's my brain.
Oh, that's lovely.
See how it's smooth? I'm not saying I have a great brain. In fact, I think I might be missing a frontal lobe. But anyway, we'll get to that later.
Okay.
This is my brain. See how smooth it is?
Yes.
No holes. This is somebody who's been on alcohol for 10 years, not addicted, just drinking regularly for 10 years. Look at the holes in the brain.
Wow.
You see that?
Yes.
Yeah, that's a problem, right?
Yeah, I think.
Yeah, that's a lot of holes in the brain. So this one is cocaine and methamphetamines, not a long history of use, but you don't want holes in the brain. Okay, so
Say no to drugs, kids.
no to drugs and stop habituating on alcohol. The whole world is habituating on alcohol right now. So actually, I was really glad to see that my brain was not really ransacked from tequila and wine. Anyway,
I've seen you on a couple of nights. I'm surprised there's not at least one hole in there. I'm just saying.
Okay, this is a scan right here of during alcohol and substance abuse.
Okay.
Here is getting off of it and recovering.
Okay.
Check out how the brain recovered itself. Is that amazing?
Yes.
So anyway, it's
now they're not really holes in the brain, right? I mean, what are we looking at? Because I mean, a hole I would think would leak.
Yes, it's really deficits in the brain. And you can see stroke victims. Here's attention. This is attention deficit disorder. So people who are not treated right here, you can see there's just a lot of defects in the brain. It's not smooth. The contour is not smooth. So there's a lot of things that need to be done. Not treating attention deficit disorder the right way causes the brain to be like excessively stimulated. And people say that all the time that have ADD. It's like their brain is like, it's on fire. Like,
but isn't that what the drugs are for? And that's what all the schools is here, take your ADD medicine and you're better.
Certain medications can help that, but so can certain supplements, and certain modifications to lifestyle behavior can make a big difference. So even people with excessive anger, people with problems with oversensitive to any information, where they fly off the handle because they're overly sensitive, that could be a certain part of the brain that just needs to be nourished more. So it's pretty exciting. This is the internal part. So this actually is my brain. So you definitely want to see red, and you want to see the active parts of the brain. This is where I actually thought maybe I didn't have a frontal lobe, but I have not been fully trained on this. Okay, so don't take my word for it yet.
What does the frontal lobe do that you'd be missing?
Well, the frontal lobe is for reasoning. right?
Yeah, you're
So
pretty
a lot of
reasonable.
so, I mean, actually, it could explain a lot, but it's just a fascinating subject for me, and I'm really excited. So, what I gave a lecture this year to our medical practitioners, all of the providers in our office. We have 27 now,
Wow.
and I gave this lecture on leaky gut and how it affects leaky brain, and why I think this is leading to all these people having anxiety and problems with depression. I mean, the incidence of anxiety and depression right now is like this. And I was talking about this with Dr. Amen, and he was saying that absolutely everything related to anxiety and depression and lack of concentration and memory and focus is absolutely just shooting straight up. And so we have to pay attention to this, because I think those three issues, anxiety, depression, and cognition, people's ability to focus and have good memory and concentration, are going to be the problems of the next 2 years. And I think a lot of it has to do with what's going on in the world. I think it has a lot to do with people's stress, and I think it has a ton to do with people's diet and lifestyle habits.
And
So,
another person, you had a special guest speaker at your gut lesson thing, our friend Suzanne Summers.
yes. So bringing those, like marrying those two things up.
Yes.
The gut, which now she's really into and has amazing products. And also Dr. Amen on nourishing the brain. And we feel so lucky. I feel so lucky to be able to work with both of these specialists, like so honored. We're going to be trained, about 9 of our medical providers are going to be trained to be readers for Dr. Amen. So when they do the scan, we will be able to do the reading of the scans, and then we will be able to do the treatment plan.
So when can I get that at OnePeak? Is that coming soon?
Well, the scans will be done at their clinic because they're very special.
So I have to go to San Diego for that? For the scan?
Yes. Yeah. They
Okay.
have scans. So the closest in Oregon would either be Bellevue or would be Walnut Creek in California. So they have various scans. And so, yeah, we would have them get the scans there, and then we would do the follow-up care and the interpretation. And so we're super excited about that, to be able to offer that to our patients.
How cool.
And I think this is something that people have to pay attention to. And it's really his desire to have as many people as possible get scanned. He wants to continue his research. The Canadian government just approved this as something that is going to be covered by insurance companies, which means Canadians are coming down and getting it done. So it's a great, exciting time to be able to have more information about how to keep your brain healthier longer. Who doesn't want a sharp brain till 125?
Absolutely. And,
I'd like to have a sharp brain.
Speaking of something, so I don't mean to name drop or anything, but I was at Suzanne Summers' house the other day, just kind of hanging out. She loves Nisha. Oh my gosh, she's going off. Nisha's the next big star. Oh, I'm telling you, Nisha's. She loves you.
I must have done a number on her. I don't know how that happened.
Oh, she loves you. Yeah. Anyway, so we're gonna find it. So it's coming soon. Your stuff with Dr. Amen.
Yes, yeah. So it'll be in the next several months that we will be one of the interpretation facilities. And these will all be done via televisit. So you can go to a facility Dr. Amen has, get the scan, and then do the follow-up with one of our healthcare professionals or theirs. They have healthcare, but they just can't keep up with the demand. Sure. And so they want to collaborate with functional medicine specialists like us to be able to help carry out the mission of getting people's brain healthy.
I like it. And if you like it, you should go to nishajackson.com. You'll find out more. Keep going there and find out more about when she starts the partnership there with Dr. Amen. And also, is there any good supplements that help the brain anything you have that you can think of?
Yeah, so two things that I think are super important for the brain. Number one is essential fatty acids. Obviously eating more fish and fatty type foods, good fats, avocados, nuts, seeds, but also, and good oils, but also fish oil capsules or omega-3 fatty acids. though our brain is fat, and so it needs good fats to stay nourished. And so that's like top on the list.
You call my brain fat?
Your brain is fat. I'm sorry, but that's good.
Okay. All right.
It's the one area you want to be fat.
Okay.
Good fat.
Hey, go to nishajackson.com and find out about the supplements and more of what Nisha's up to. Also, her book, Brilliant Burnout, is still on Amazon and stores. And make sure you hit the subscribe button. You don't want to miss any of the brilliance coming from Ms. Nisha Jackson. I know I don't. Anyway, we sure appreciate you. Subscribe, share this with your friends. Until next time, I'm Rusty Humphries. There's Nisha Jackson, and this is the Nisha Jackson Podcast.